With Session Update, I'm Julie Bartke. The Senate continued to move its bill to create an insurance marketplace, which would give Minnesotans an opportunity to purchase health insurance online, and it's a portion of the Federal Affordable Care Act. Senator Tony Laurie presented his bill to the Senate Health, Human Services, and Housing Committee. We'd like to show you a portion of that committee.
I fully recognize how what a big change this is to a huge sector of Minnesota's economy, one that makes a big difference to our entire healthcare community and actually to our people and our small businesses, where they live and where they work. So I really am taking all of the concerns seriously. I have an open door policy. I've been trying to make sure that I balance the needs and come out with a bill that meets the needs of industry and consumers.
Even though we are paying hundreds of dollars a month, it feels as though we have no health insurance at all. So my wife Heidi continues to constantly be on the lookout for a better deal for our insurance, spending a fair amount of time at it, taking away from time we can spend on our small business. Again, another penalty to small business owners. Now we're faced with the possibility of growing our small business, and you'd think this would be a good thing, and it is, and it's in our plan for the next few years. But like other small business owners, we're waiting to see if providing employees with health insurance is even going to be possible. So we're very excited about the changes being made. I'm here in full support of Senator Laurie's bill the way it is. Heidi's looking very forward to an exchange where she can easily compare health care plans, and we very much hope that the Minnesota Healthcare Exchange bills continue and pass with the provisions that allow the state to negotiate group rates. This would greatly encourage us to more vigorously pursue our plans to grow our business and create more jobs.
What would the Chamber's solution be? We would suggest that an any willing plan model is preferable to the model contained in the bill currently. This would allow for a robust market outside the exchange, and it would ensure that criteria set both by federal and state governments, criteria for plan certification that already are designed to protect consumers, would make sure that plans develop products that are protecting consumers, but that once they do so, they are allowed to access market and provide consumers the choice from which they so well benefit. Ultimately, the Chamber is committed to finding an insurance exchange that will work, but we are on a tight timeline, and we do not need to address this controversial issue at this time. The federal government does not require an active purchaser model. Indeed, other states that have marketplace facilitating models or any willing plan models would receive conditional approval. We humbly respect and suggest that you focus on functionality, avoiding the dangers of overreach, and please consider amending this to reflect an any willing plan model instead of an active purchaser model.
Most serious concern remains with the active purchaser model. As representatives of both individual and group insurance consumers, many of them, we do not believe that the market will continue or will welcome an exchange board with just a 4-person majority to decide which products are best for the entire state of Minnesota.
The structure of the bill, what's allowed right now, is not active negotiation with carriers in regards to the costs of the plans. I mean, I fully believe that every single one of our carriers in Minnesota will be able to meet the standards that'll be set for them to meet, and will have access to this new marketplace for their consumers. But the estimates are based on 10 carriers presenting, 7 to 10 carriers, and they're looking at estimates of 10, with 10 plans each. That's 100 plans being put forward, and I think that, you know, there's a lot of choice there.
What is the value of having that active purchaser model? We already have determined, or will determine, what the qualified health plans are. So if those parameters are already being met, why would we want the Minnesota government to come in and say only certain plans that are meeting that criteria or those parameters are allowed on the exchange? What are you driving at here?
Senator Laurie.
Madam Chair, Senator Nelson, we're driving at better value for consumers. Maybe one of the best examples is, you know, our state Medicaid program today. I mean, the upcoming biennium that we're setting a budget for has $1 billion in savings in it that is redirected to other programs within our HHS budget, as the governor has presented it. That value largely being driven by the competitive bidding process, the profit caps, and the growth caps imposed on today's market.
The state must pass its legislation by March 31st, or Minnesota will be rolled into a federal exchange.